In order to use the finger-on-finger fulcrum, you'll place the finger in the vestibule, making sure to make it very stable on the attached gingiva, not into the depth of the vestibule. You'll place the finger of your dominant hand onto the finger of your non-dominant hand. You'll adjust the instrument to make sure it's adapted to the tooth surface. Close the blade slightly for insertion. Start off with an exploratory stroke. After detecting calculus from this position, you'll then go to your calculus removal stroke. Notice the wrist. It remains neutral. Most of the wrist action comes from the wrist. The non-dominant fingers place a stable foundation for which to put your dominant hand on, thereby enabling access to different areas of the mouth. For right-handed clinician, the finger-on-finger is used primarily on the patient's right side. For left-handed clinician, this is used primarily on the left side. Another option for using the finger-on-finger fulcrum is to use it on the mandibular area. This would be to access the mesial surfaces of the premolars and molars. Placing your non-dominant hand, index finger in the vestibule, firmly on the attached gingiva, you'll use your dominant hand on the non-dominant index finger. Adapting the instrument, insert subgingivally, use an exploratory stroke, and then use your calculus removal stroke once you come across calculus. You'll notice that there's a lot of wrist activation motion in this fulcrum. This is a very powerful stroke to access calculus on the deep pockets of the mesial surfaces of the premolars and molars. Now we're going to demonstrate the opposite arch fulcrum. We're going to place the fulcrum finger from the dominant hand on the incisal edges or the facial surfaces of the mandibular anterior teeth. Then the instrument will be telescoped out to reach the maxillary molars or premolars. We'll again use an exploratory stroke to detect calculus, and before applying pressure and using our working stroke, we're going to add a finger assist. The finger assist for the mesial surfaces of the maxillary dentition is going to be placed on the front side of the instrument. The idea behind the finger assist is to help guide the instrument so the instrument won't fly off the tooth. We want to help to keep it in the correct position, particularly when we're telescoping it from a distance with this fulcrum. The finger assist will apply a slight amount of pressure, but not a lot of pressure. When using the opposite arch fulcrum for the distal surfaces of the maxillary molars, we're going to again apply the fulcrum on the mandibular anterior teeth, either on the incisal edges and/or the facial surfaces. Pull the instrument up to adapt to the tooth surface. This provides improved parallelism and assists with maintaining the shank against the tooth. We're going to use a finger assist on the back side of the instrument. This again is to help guide the instrument, keeping the instrument on the tooth surface as we're scaling. Occasionally, we may add the thumb also to provide additional stability with very slight amount of lateral pressure. This fulcrum technique provides improved access to deep pockets and facilitates parallelism to the proximal root surfaces. This is a very powerful stroke to be used on the maxillary dentition, especially in deep pockets.